Negligence. Ethical basis. The physician-patient relationship is primarily based on trust, which is recognized in the concept of fiduciary duty, the responsibility to act in the patient's best interest. Negligence or malpractice is a form of failure on the part of the physician in fulfilling their fiduciary duty in providing appropriate care and leading to harm of the patient and/or abuse of patient's trust. Legal basis. Physicians are legally liable to their patients for causing harm, tort, through a failure to meet the standard of care applicable under the circumstances. Standard duty of care is defined as one that would reasonably be expected under similar circumstances of an ordinary, prudent physician of the same training, experience, specialization, and standing. Liability arises from physicians' common law duty of care to their patients in the physician-patient relationship, or in Quebec, from the Civil Code provisions regarding general civil liability. Actions in negligence or civil liability against a physician must be launched by a patient within a specific prescribed period required by the respective province in which the actions occurred. Four basic elements for action against a physician to succeed in negligence. 1. A duty of care owed to the patient, that is, physician-patient relationship must be established. 2. A breach of the duty of care. 3. Some harm or injury to the patient. And 4. The harm or injury must have been caused by the breach of the duty of care. Truth-telling. Ethical basis helps to promote and maintain a trusting physician-patient relationship. Patients have a right to be told important information that physicians have regarding their care. Enables patients to make informed and autonomous decisions about health care and their lives. Legal basis required for valid patient consent. Goal is to disclose information that a reasonable person in the patient's position would need in order to make an informed decision, standard of disclosure. Withholding information can be a breach of fiduciary duty and duty of care. Obtaining consent based on misleading information and/or insufficient information can be seen as negligent and/or coercive. Evidence about truth-telling. It is a patient's right to have the option of knowing about any clinical conditions, diagnosis that they may have. Most patients want to be provided with information regarding their health. Although some patients may want to protect family members from bad news, they themselves would want to be informed in the same situation. Truth-telling improves trust, adherence, and health outcomes. Informed patients are more satisfied with their care and most often receive news about their health better than expected. Negative consequences of truth-telling can include decreased emotional well-being, anxiety, worry, social stigmatization, and loss of insurability. Sorry. CPSO Policy on Truth-telling. Physicians should provide patients with whatever information that will, from the patient's perspective, have a bearing on medical decision-making and communicate that information in a way that is comprehensible to the patient. Medical error. Medical error may be defined as a preventable adverse events, AEs, caused by the patient's medical care and not the patient's underlying illness. Some errors may be identified before they harm the patient, so not all errors are truly adverse. Many jurisdictions and professional associations expect and require physicians to disclose medical error. That is, any event that harms or threatens to harm patients must be disclosed to the patient or the patient's decision makers and reported to the appropriate health authorities. Physicians must disclose to patients the occurrence of AEs or errors caused by medical management, but should not suggest that they resulted from negligence because negligence is a legal determination. Error is not equal to negligence. Disclosure allows the injured patient to seek appropriate corrective treatment promptly, if possible. Physicians should avoid simple attributions as to the cause and sole responsibility of others or oneself. Physicians should offer apologies or empathic expressions of regret. For example, I wish things had turned out differently, as this may help to maintain and/or rebuild trust and are not admissions of guilt or liability. Apology acts across Canada protect apologies, both as expressions of regret and admissions of responsibility, from being used as evidence of liability and negligence. Errors of care are compatible with non-negligent care if they are ones that a reasonably cautious and skilled physician could make, that is, mistakes can be made due to honest error. Adverse event: an unintended injury or complication from healthcare management resulting in disability, death, or prolonged hospital stay. Breaking bad news. Bad news may be any information that reveals conditions or illnesses threatening the patient's sense of well being. Different patients may classify bad news in different ways. Disclosing medical information in a poor or insensitive manner may be as harmful as non disclosure. Caution patients in advance of serious tests and about the possibility of bad findings. Give time for patients to reflect upon the situation prior to disclosing such news. Give warnings of impending bad news by reviewing prior discussions. Provide time for the patient to ask questions. Adequate supports and strategies should always be provided following the disclosure of difficult news. Spike's protocol was developed to facilitate breaking bad news in a conscientious and effective manner. Setting, SPIKES, so setting, perceptions, invitation, knowledge, empathy, and strategy. We'll see it in palliative medicine. Other tools, such as the Serious Illness Conversation Guide or Vital Talk, can also assist with conversations with patients with serious illnesses. Examples of warning of impending bad news. Remember to clarify, invite, the level of knowledge desired by the patient. I have something difficult to tell you. Unfortunately, the results are not what we were hoping for. This may come as a shock to you, but the tests indicate there is no easy way for me to tell you this, so I will tell you straight away that you have a serious problem. Arguments against truth-telling may go against certain cultural norms and expectations, may lead to patient harm but only in extreme rare situations. Medical uncertainty may result in the disclosure of uncertain or inaccurate information. Exceptions to truth-telling. A patient may waive their right to know the truth about their situation, that is, decline to receive information that would normally be disclosed when the patient clearly declines to be informed. A strong cultural component exists that should be respected and acknowledged. The patient may wish for others to be informed and to make the relevant medical decisions for them. The more weight of the consequences for the patient from non-disclosure, the more carefully one must consider the right to ignorance. Emergencies. An urgent need to treat may legitimately delay full disclosure to the patient, and or the SDM, the substitute decision maker. The presumption is that most people would want such treatment and the appropriate SDM cannot be found. Therapeutic privilege, withholding of information by the clinician in the belief that disclosure of the information would itself lead to severe anxiety, psychological distress, or physical harm to the patient. Clinicians should avoid invoking therapeutic privilege due to its paternalistic overtones. It is a defense of non disclosure that is rarely accepted anymore. It is often not the truth that is unpalatable, it is how it is conveyed that can harm the patient. That's it. Next video, ethical issues in healthcare.